Hi YouTube, welcome back. I want to talk about hormone numbers today because I've had so many patients come in the clinic and tell me that, yeah, my OB/GYN checked all my numbers, my urologist checked all my numbers, my primary care doctor checked all my hormone numbers, and they told me that everything is fine. I'm in the normal range and I don't have to do anything. And I'm like, can I see it, please? Right? Why? Why am I asking that I want to see those labs? Okay, let's talk about it today because this is one of the biggest things that you need to understand as you're advocating for your own health. You have to understand that in laboratory medicine, what we call normal is actually more of a reference range. Let me step back and explain that a little bit further, okay? Before I tell you what I'm looking for in the blood work, when a patient gets hormone blood tests, there is this column right next to your value, like they get you your result and then they put next to it this reference range. And for a lot of things, we look at this reference range and call it the normal range. But I want you to understand how we came up with that number. A reference range is determined by the laboratory. Yeah, you heard me right. The laboratory. So if you, for example, go to Quest Diagnostics or LabCorp or CPL or Access Medical Lab or whatever lab is in your area, or your local doctor's office, sometimes some doctors have a private lab, they figure out the reference range based on the number of tests that they have run, and they come up with this number of, well, out of everybody that we've ran, the numbers fall between here and here, and now that is the reference range. Nowhere does that sound normal to me. Does it sound normal to you? Okay, let's digest that a little bit, okay? Because what normal means is that, well, at least that's my understanding of normal, means that there's no disease, everything is working like it should, it's optimal, is actually what I'm thinking normal is, but what that's telling me is we're actually not saying that the reference range is normal. The normal number might be found somewhere in there, but the reference range could also include patients that are diseased. Let that sink in a bit, right? Because who do doctors usually send to the lab? Well, we send healthy folks, right? Just to make sure they're healthy. But we also send patients that we know there's something wrong with them. We're trying to find out what's wrong. So when the lab takes those numbers and says, well, that's now the reference range, that includes patients that are diseased and patients that are normal. So if I'm now using that range as the reference range for my patient that wants to know where they need to be, do you see what's wrong with that picture? Especially when it comes to hormone, this is very, very important, okay? For, chemistry is things like, where should potassium be? Where should magnesium be? Where should chloride be? We have kind of come up with an acceptable normal, right? Because we can clearly see patients that their potassium is low, what happens to their heart function? Or if their sodium is low, what happens to their brain function? Like, we see that clearly. So we have established these very tight ranges where patients need to be for those chemistries. But when it comes to hormones, for some reason, there is this range, and the range also changes, especially for women, right? Because we're going through different phases of our cycle each month. So we got numbers for the luteal phase, we got numbers for the ovulation phase, we've got numbers for all the other phases, and they're all different. And each hormone is different at each level, and it gets very complicated and confusing. So for a lot of women, we don't even know what we should say the normal is, right? But there are certain numbers that we have come to realize that, for example, if your testosterone level is not at least this, or if your estrogen is not at least this, you are going to experience this certain symptoms. Why? Because we have seen plenty of patients that when their levels drop below this level, oh, that's when the hot flashes start. Or when their level drops below this level, oh, with progesterone, that's when they start having trouble with sleep. Or for, the case of testosterone, for women and men, we have numbers that we are looking at in the blood work now to say, okay, if it's not at least here, it's not optimal. Right? It might still be in that normal reference range, but it might not be optimal for the symptoms that you are having. Okay? So let me throw some numbers out there. Let's say you go get testosterone, right, as a female, and your number comes back and it says 40. Well, what does that mean? 40 is within the normal reference range. But you came to me with night sweats, with no energy, with no libido, with brain fog issue. Well, and 40 is not normal for you, is it? Because if I've ruled everything else out, that could be causing the fatigue, that could be causing the lack of sleep, and so on. And the only thing I find in your blood work is this testosterone level that, in my opinion, maybe it's not optimal. Then we need to talk about where should I get it to at least help you see if we can alleviate some of those symptoms, right? This number of anywhere from 80 to say even up to 300 in some women is kind of what we're finding, that the symptoms start to disappear when we get the hormone levels kind of into those ranges. Same thing with the estrogen. We're finding that for a lot of women, if their estrogen level stays below 50, they're going to be very symptomatic. In fact, a lot of women are considered menopausal when their estrogen level reaches 30 or below. But the reference range for estrogen can be anywhere from 30 all the way to 300, 400, 500. So where in that spectrum do you want to be, right? And we know the higher the estrogen gets, sometimes it makes it harder to lose weight. Sometimes it makes it, where you bleed excessively. So again, that's considered the normal range. So you do see why hormone replacement and the treatment of it has to be individualized. We cannot just go with these so-called lab reference ranges and just say, okay, well, it's in the normal range, so all the symptoms you're having cannot be your hormones, because it might not be true. And we see this with progesterone as well. We see women, once their progesterone level gets below 5, they start having trouble with sleep and things like that, right? So we use these numbers to try to help figure out, okay, well, if your number is below this and you're symptomatic and we can't find any other explanation for why you're having this issue, maybe optimizing your level higher while checking the feedback loop. Remember, we discussed that in other videos, right? The FSH level, the LH level. We're also checking that to see if the brain is sensing that there's enough hormones in the blood, right? So it's not just about the individual hormone levels, but also the feedback hormones, the other chemical messengers coming from the brain. Is that also showing that it's optimal? Okay, so we're putting all those pieces together to really figure out where are you in terms of being optimal, not normal. Remember, we've just debunked that. Okay, we want you to be optimal, okay, in your hormone levels. That is the goal. Now, if you haven't subscribed to this channel, do so right now. We're going to go deeper into these topics, these numbers and things like that in my private VIP group, okay? It's the school app. You can see the link in the description section below. Join that so that when I have those classes, those free classes, you'll be notified to join in, okay? So we can expand on this topic, educate you better, so you can advocate for your health as you talk to your primary doctor, your OBGYN, and your endocrinologist. See you soon.